in West Hollywood, and I'm here with one of our favorite patients. This is Paul. You guys might know of him as Violet Chachki. So Paul is a world-renowned drag performer. He won RuPaul's Drag Race, right? He's been in Vogue. He's been, I mean, this is a major celebrity. I think so. I love this. This is like one of my favorite people because it's so cool that he has this whole alter ego. So I've been working with him for a few months now. How long has it been?
It's almost been like 8 or 9 months.
8 or 9 months.
I would say.
And initially he came in with acne, and obviously that's caused by the performing, the lights, the makeup. That whole combination can really take its toll on the skin. So we've been treating him for the acne, and his skin is so clear. Like right now he doesn't even have anything for me to extract, not even any blackheads. Like this is amazing. But we do have a little bit of scarring, we have a little bit of textural irregularities, so we're treating that. That's where we're at now in the treatment plan. So I'm performing the SilkPeel DermalInfusion right now on his skin. We do this every single month as maintenance to keep the pores clean, to keep everything exfoliated, and to hydrate. But we're going to be prepping to do a Fractora treatment on him to help with the texture, which we're going to do next week. So today is just his monthly facial. The DermalInfusion uses a diamond tip to help exfoliate the skin. It's our physical form of exfoliation. And then with use of the serum, we have a little bit of chemical exfoliation. The solution I'm using is the clarifying solution. It has some salicylic acid in it, which is a beta hydroxy acid, and will decongest the pores. It's oil soluble, so it'll break up any buildup in the pores. We have several different serums for this. So no matter what your skin type is, this is something we can do. It's non-invasive, no downtime. Obviously you see a little bit of redness on the skin, and that's normal. This uses suction to help eliminate the debris in the pore. So the redness is totally normal, and you leave a little pink, but after an hour or so, your skin is just glowing. So this is appropriate for anybody the day of or a few days before a big event, as it makes the skin look really refreshed. So the other serums, we have an anti-aging solution with vitamin C, so that helps with antioxidants to help fight free radical damage in the skin. There's a hydrating solution, and then there's a brightening solution that helps with pigment. So anybody with melasma, hyperpigmentation, that's a good option. And we recommend this for at least monthly treatments, just to keep the skin really healthy and clean and functioning properly. These vacuum-based facials are really, really good because it's gonna help eliminate any buildup in the pore. And that's, for most people, a big problem. And it doesn't hurt, which is a good thing. There's no downtime, so again, it's good for anybody right before an event. And there's also larger tips, so we can do this on all areas of the body. You can treat the back, the arms. A lot of people get breakouts in those areas, so this is really a great part of the treatment plan for people when we're treating acne on the body. Do you guys have questions on the live?
How do you know which serum is best for which patient?
Well, anytime we have a patient come in, we're gonna do a consult and ask them what their needs are, what their main concern is. So it's all part of the process, you know. As a skincare professional, we look at the skin, we see what's going on, and then we make the best suggestion. So we're doing the pore clarifying because at the end of the day, even though he doesn't really have active breakouts right now, we are treating him. He's on an acne regimen, so this is preventative. It's not only going to help clear up acne that's currently happening, but it's going to help prevent breakouts from occurring. So that's why we choose this solution for him. But it's always custom. No matter what we're doing here, we're using our best judgment to give the results desired and treating the specific skin type and concern.
What does it feel like?
What does it feel like? What do you think?
Like a really intense scrub.
Yeah, it's
with like some suction.
Yeah, it doesn't hurt at all. It feels, some people say it feels like a cat licking you because they have that rough tongue. Some people, I don't know, if you guys have ever had a microdermabrasion, it's very similar. It has the diamond tip that some microderm machines use, and then instead of the other type, there's the crystal microderm. Instead of this spraying out crystals, it's spraying out a serum. So it feels a little bit more gentle, in my opinion. So yeah, what else? That's it? Okay. So we're gonna continue treating him with the Silk, and then we're gonna come back and show you guys some of the salt facial. And we do this combination often, not only for acne, but for all skin types, just because this double exfoliation really, really helps to make the skin look really good, and is always recommended for a monthly treatment. So stay tuned, we'll be back in a little bit.